Hey everybody. When we think about our health, often we ask ourselves what prompted that thought in the first place? What makes you all of a sudden anxious to go to your doctor to get a checkup? Well, it's probably because your emotions was tampered with in some way. That's right. Either it was tempered through a direct healthcare experience or crisis, or indirectly through messaging about others' healthcare experiences or crisis. It's easy to understand that if you get sick, you would be prompted to seek healthcare advice or go to your doctor's office to determine if you need antibiotics or not. These direct healthcare experiences would certainly tamper with your emotions, right? And encourage you to make the right choice of making an appointment with your doctor. How about if you heard that someone that is close to you, such as a family member, or someone who is not that close, for instance, like your favorite celebrity, who may had an unfortunate healthcare experience, like they may have been diagnosed with colon cancer or a heart attack. I'm sure your emotions will certainly be tempered with them too. Look, although this is an indirect healthcare experience, it can surely prompt you to seek healthcare advice for sure from your doctor or any other healthcare provider you may have. Now, you might think that being prompted like that can only be good, right? Sure. It is very reasonable for anyone to go and seek medical advice when prompted in such ways that develop awareness, okay? Awareness helps us stay healthy and live a quality life. We all know that. But what happens when these messaging force your emotions to go way past the benefits of simple awareness? That's right. When you believe that the disease you just heard about, you were just made aware of, all of a sudden is a disease that you think you have, or you at a greater risk of that disease, or your environment is at a greater risk of having it than it really is. This is when you enter the realm of what they are calling availability heuristic. That's right. That's when the disease that killed your favorite celebrity, okay, although it's being publicized in the news, does not necessarily mean that more people are getting it or that you are at a higher risk to get it yourself. That's why knowing the prevalence of a disease and your risks is very important in that particular moment. See, this is when you should rely on your physician to help you figure that out. Whether, need to figure out whether you're at the risk of the disease or not, but you really need to figure that out. You see, your constipation doesn't necessarily mean you are having colon cancer, just like your celebrity did. You think that because last week you heard someone famous passed away with colon cancer after having constipation. And all of a sudden, you start thinking you might have it too. Okay, so after losing sleep for several days, you finally make it to the urgent appointment that you made with your physician, right? Only to hear them tell you that after hearing your symptoms, examining you, reviewing all the tests, and assessing all your risks for colon cancer, and they say that your risk is actually low, and that you are more likely experiencing symptoms from not drinking enough water, and that you might have anxiety. That is right. Your symptoms of constipation can easily be treated with increased fluids and Xanax perhaps. Look, awareness is important for the sake of prevention and early screening, but worrying due to availability heuristics is not the way to go. Now, it is your choice to either feel relieved by what your physician's assessment and take your Xanax, with lots of water of course, or you develop distrust and find a second opinion with a new physician. Either way, the importance to have a physician or healthcare provider that you trust to evaluate you or to at least have the conversation with is so important. Since your awareness prompted you to see your doctor in the first place, I would encourage you to keep that in mind, especially when you hear your physician tell you something completely different from what you expected. And they tell you something that you didn't expect and let you know that your true risk is lower than you thought. Not accepting it can actually be a sign that you are suffering from this phenomenon they are calling availability heuristic. That is right. The more you hear about a disease or the more available the information is, the greater you may think the magnitude of that information really is. You might go and get a second opinion if your doctor don't agree with you, and that's fine. This becomes a tricky topic due to the thin line that exists. See, my patients and those who know me knows that I always advocate for patients to reasonably challenge physicians to get answers to their pressing health questions. But remember, the key word here is reasonably. Although getting your questions answered is certainly important, but it is equally important to also understand the facts and the risk analysis that's being presented to you by your healthcare professional. That is right. You have to at least understand the application of the science and the epidemiology as a baseline in order to assess your true risk of that particular disease. Or you can choose what most of my patients do. They decide to just trust me, right? But before they do that, they respect the science and the epidemiology of the disease while trusting me to advise them. That is right. They hire me because they trust me as their physician, so I can do all the statistics and risk assessment that is necessary, so I can potentially give them the best chance of survival. And I present it to them. I use both objective and subjective data in order to make a plan ahead for my patients. My patients are smart, okay? And they're smart enough to understand that. You see, if my patients and I decide to pursue more testing based on the risk I assess, then we do it. But if I decide that the risk is too low and I'd rather not do anything at all, they generally agree to that too. Whenever I decide not to pursue more testing for my patients, it's because I do not want to expose them to unnecessary harm. That's right. Can you imagine? I mean, look, for instance, after analyzing data, such as an MRI or even just their clinical presentation, I may decide against doing a prostate biopsy that can potentially put them at risk of complications such as impotence. And trust me, most of my male patients thank me when I do not put them at risk to lose their abilities to have an erection, okay? So if you are not talking to your physician, then you really should. You really need to find a provider that you can trust and talk to. So this thing they call availability heuristic is when you overly rely on the messaging you are exposed to. You misjudge the magnitude of your risk because the disease you are hearing about or the complications with let's say a particular medication that is being reported may be popular now as it is being discussed and displayed in your face, right? Because it's there all the time. It's in the forefront of your mind. So therefore, it's overstated by news reporters as well as social influencers on social media. This has now caused you to start thinking that this complication that they're talking about from taking this medication is common. And your risk of having the same complication, for instance, is much higher than it really is. And you decided to stop the medication, even though only 1% of the population is truly at risk of having it. Hope that sinks in. Our minds sometimes can fool us in thinking that the magnitude of a particular problem is much bigger than it really is. We have to agree at some point to consider the true statistics of a disease, the true statistics and of complications of medications. We have to understand and we have to agree to that. We have enough historical data and scientific rigor in medicine to do so. So when the benefit outweighs the risk, you have to know that. By knowing the incidence of a particular disease, for instance, and taking the expert advice from your physician, it's only going to get you closer to the true risk and understanding what that really is. Whether if it's a risk of a disease or a risk of having a complications from a medication. The news and social media cannot be your source for how many cases that truly exist about an issue, and certainly cannot be your source to tell you how high is your personal risk of getting that disease. This is why I encourage you to let your physician know about your thoughts and concerns so she or he can help walk you through this and help you walk through the thought process of identifying your real risk. Remember, medicine is at the individual level. It's personal to you. Although medicine cannot be 100% on identifying a true risk of a particular issue, but we get very close to 100%. We really do. When we collaborate the research, right, with your physician's experience. That is how you should always make health choices. It's all about practicing all of the options that is made available to you in order to get closer to the right answer. Do not let social media or the news dictate your choices for your health. Certainly do not let it make you overly confident about what you think you might have before speaking to your physician. Because if you fall for the availability heuristics, it can certainly expose you to unnecessary harm and maybe even distress. So in summary, when the news tamper with your emotions and cause you to be concerned about a disease, a condition, or even a medication you're taking, please remember to have the discussion with your trusted physician or healthcare professional so you both can co-create and identify your true risk and determine if more testing is needed or if you need to stop that medication or not. I want you to have awareness, not availability heuristics, because that can certainly put you at harm. Look, I personally refuse to put my male patients through that. I mean, how in the world am I going to be able to explain that to their wives, right? Remember, your physician can also fall for the availability heuristics as well. And they may offer you more testing than you really need. This is why I always encourage people in the community to challenge their physicians so they can offer you the science, the statistics, offer it to you and show it to you, the epidemiology, tell you about it, as well as their expertise. This way, you can really understand your true risk without any bias. Anyway, I am Dr. Coupet. I'm the People's Doctor. Thanks for listening.